a 2-minute warning. Reporters on the line, please press 1 to ask a question.
Good afternoon. Thanks for joining us. Sorry for the delay this afternoon. We were all watching former President Obama deliver the eulogy for Congressman John Lewis and wanted to have the opportunity to watch the end of that. So thank you for bearing with us here. So again, I am Mandy Cohen. I'm the Secretary of the Department of Health and Human Services for North Carolina. And today I am joined by Victor Armstrong, Director of the North Carolina Division of Mental Health, Developmental Disabilities, and Substance Abuse Services at the Department of Health and Human Services. I'm also joined today by Director Mike Sprayberry. Lee Williamson and Monica McGee are our American Sign Language interpreters, and Jackie and Jasmine Matevier are our Spanish translators. So first, as always, I'll start with a rundown of the numbers. As of this morning, we had 120,194 laboratory confirmed cases. We had 1,239 people currently in the hospital, and sadly, there have been 1,903 deaths. Today, we had a jump up in new cases with about 2,300 new cases today. Our percent of tests that were positive still remains steady at 8%, and steady, we were on our hospitalizations as well. The steps we have been taking as a state, especially wearing those face coverings, continue to be our best weapon against this virus. I was pleased to see new survey data yesterday showing that we have some communities in North Carolina where more than 80% of people are always wearing face coverings in public. And that's great, but we want to see that in every community across our state, and we also want to get that number up to 100% in all of our counties, so more work to do. So since the start of this pandemic, we have been focused on addressing the impacts of North Carolina's overall health, and that certainly includes mental health. This pandemic has taken a toll on all of us, from people who have been infected with the virus and their family and friends, to healthcare professionals and other frontline workers, to those that have felt the economic impacts of this pandemic, to all of those feeling isolated or experiencing anxiety and stress during this difficult time. We are seeing concerning evidence of sharply increased rates of anxiety and depression in North Carolina, especially amongst younger people. We're also seeing higher rates of emergency room visits for substance overdoses and higher rates of binge drinking. If you are experiencing depression, anxiety, or stress during this pandemic, you don't have to go through it alone. there are resources we can connect you with. And if you have started or continue to use substances in an unhealthy way, there's help available. In addressing mental and behavioral health during this pandemic, our department has 3 goals: to increase access, to improve awareness, and to combat stigma. To improve access to care, we have moved quickly to allow providers to offer a broad array of behavioral health services via telephone and video, facilitating remote access to counseling and other services. But unfortunately, North Carolina is coming out of the gate at a disadvantage in terms of increasing access to care, particularly for mental health services. We are one of only 13 states that have not expanded Medicaid. Because of that, we have had to allocate federal CARES Act dollars to fund mental health treatment for the uninsured that would have otherwise been covered by Medicaid. And so we haven't been able to use that money to fund as broad a prevention and resilience effort as we would like to. As with other facets of the pandemic, the mental health crisis is disproportionately impacting historically marginalized populations in North Carolina. July is National Minority Mental Health Awareness Month, which recognizes that while anyone can experience the challenge of mental illness regardless of their background, we know that culture, race, ethnicity, and sexual orientation can make access to mental health treatment much more difficult. That's something we recognize at our department and that we're working to integrate throughout our work in this area. With that, now I'd like to introduce Director Victor Armstrong to share some important resources and strategies that we're encouraging North Carolinians to use. I'll turn it over to Victor now.
Thank you, Secretary Cohen. During the COVID-19 pandemic, symptoms of depression and anxiety have tripled. We've also seen a 15% increase in emergency department visits for opioid overdose. The behavioral health challenges brought on by this pandemic are great. Not only has the virus led to personal experiences of uncertainty, illness, and the loss of loved ones, but has also profoundly impacted the social determinants of health, including housing, employment, access to health insurance, and nutrition. As a state, we must be prepared to address the long-lasting stressors presented by this pandemic. We can do this by building resilience, raising awareness, and increasing access to behavioral health care. We particularly need to target trauma, suicide prevention, and substance use. COVID-19 has highlighted pre-existing health disparities. We must enhance outreach efforts to historically marginalized populations who have been disproportionately impacted by this pandemic. Thanks to the CARES Act and other federal funding, we've been able to provide additional state-funded mental health and substance use services for the uninsured and underinsured. We've also been able to support our behavioral health and IDD residential facilities and group homes who care for some of our most vulnerable residents. But there's more to do. Beyond funding, we need to highlight ways to manage the stressors brought about by this pandemic and provide individuals with access to early intervention. So let me share with you the SCOOP on managing stress. SCOOP is an acronym that we created to help you remember some helpful tips. S, stay connected to family and friends, because social connections build resiliency. C, compassion for yourself and others, because self-compassion decreases trauma symptoms and stress. O, observe your use of substances, because early intervention can prevent long-term problems. O, it's okay to ask for help, because struggling is normal. Asking for help is empowering. And P, physical activity to improve mood, because exercise boosts mood and lowers anxiety. To help North Carolinians access help, we have created our Hope for NC crisis line. Hope for NC can be accessed by calling 1-855-587-3463. The Hope for NC helpline connects North Carolinians to mental health and resilience supports. It is available statewide, 24 hours a day, 7 days a week. Hope for NC includes a crisis counseling program, which will provide immediate crisis counseling services to individuals affected by the ongoing COVID-19 public health crisis. For our healthcare and childcare workers who are on the front lines of this pandemic, we've also stood up the Hope for Healers helpline. Hope for Healers can be accessed by calling 919-226-2002. It has been established in partnership with the North Carolina Psychological Foundation and provides mental health and resilience supports for those on the front lines of this pandemic. It is also available 24 hours per day, 7 days a week, and is staffed by licensed mental health professionals for follow-up. We urge our state and our communities to join us in this effort as we seek to improve access to services, reduce stigma, and normalize the conversation around behavioral health challenges. We are all in this together. Thank you.
Great. Thank you, Director Armstrong. I really appreciate your leadership on this work and the work of all of our behavioral health professionals across the state that I know are working hard to help us recover and respond to this pandemic. With that, I'll now turn it over to Director Sprayberry.
Thank you, Madam Secretary, and thank you for your partnership. First today, I want to talk about Tropical Storm Isaias and its potential impacts to the state of North Carolina, as well as how our evacuation and sheltering will be different for this hurricane season during the COVID-19 pandemic. Tropical Storm Isaias was named last night, and the current forecast track puts it along the North Carolina coast on Monday. This storm is still about 4 days out. The track is somewhat uncertain, and this forecast track could change. We will keep a close eye on the development and the track, and you should too. Now is the time that we all need to be prepared for hurricane season. Here's how things will be different this year. This year, we want people living near the coast or in areas prone to hurricane-caused flooding to make a plan to stay with family or friends or at a hotel if they have to evacuate. Staying at a shelter will not be a good primary option during the pandemic and should only be a last resort. If you live at a safe place inland, offer to let family or friends evacuate to your home. And in your emergency kit this year, be sure to include face coverings, hand sanitizer, and cleaning products to help keep your family healthy. Visit readync.org for a complete list of items to build your emergency kit. Non-congregate sheltering options like hotels and dormitories are preferred this year, but they are not guaranteed. This option will depend on hotel availability at the time of the storm impact. Evacuees who need shelter will go first to a reception center to be assigned to a sheltering option that fits their needs. Congregate shelters will be open this season for people who have nowhere else to go. Local governments and the American Red Cross will be working to implement health screening, social distancing, and cleaning protocols in shelters to prevent the spread of the virus. There will be more small shelters with fewer clients. Many of the older volunteers who help run congregate shelters will likely be not available due to the pandemic. So the Red Cross needs people like college students who can step up and become trained as disaster volunteers. Volunteers can help with shelter reception, feeding, dormitory management, information collection, and other vital tasks. If you're over 18 and willing and able to work in a shelter, visit redcross.org/volunteer today to get started. That's redcross.org/volunteer today. There are many other organizations with disaster volunteer opportunities as well. VolunteerNC.org is a good place to look for those opportunities. The new Know Your Zone program is also in effect this year. 20 coastal counties have developed coastal evacuation zones based on areas most at risk due to storm surge and river flooding. Visit knowyourzone.nc.gov to see if you live in one of these zones. If you do, remember your zone and listen for it if evacuations are needed and ordered. Today is 143 of the COVID-19 response at the State Emergency Operations Center. We're continuing to provide PPE to a variety of groups to include schools, farm workers, courts, and others to prevent the spread of the virus. We will maintain our COVID-19 activation while also monitoring and responding to the storm as needed. Lastly, remember to observe the 3 W's like Madam Secretary says. Wear a cloth face covering, wait at least 6 feet apart, and wash your hands often. That's wear, wait, and wash. This is how we slow the spread of the virus, working collectively together. As always, don't forget to look out for your family, friends, and neighbors, and to call your loved ones daily. You just heard Director Armstrong talking about it. Guaranteed they'll appreciate it. With kindness and cooperation, we'll all get through this together as a one team, one mission, and one family. Thank you very much, Madam Secretary.
Well, thank you, Director Sprayberry, and thanks for your leadership handling multiple crises on multiple fronts, and make sure that you do heed Director Sprayberry's words about volunteering. If you are able to volunteer to help us with sheltering, that would be greatly appreciated. All right, with that, we will remind you that the most important thing you can do to slow the spread of the virus is continue to do your 3 W's, wear, wait, and wash, and with that, we'll take your questions. Thank you.
Our first question today is from Dee Dee Gatton with WBTV.
Hi, Dr. Cohen. This is Dee Dee Gatton with WBTV. Sources say CMS is going to a full remote learning. What is your response to that?
Sources say that, in Charlotte that they're going to full remote learning. I think that they are going to full remote learning. I think they're coming back for, my understanding is they're coming back for a first week to do some orientation for their teachers and their students, and then they'll be operating remotely. As you know, the governor has put together extensive K-12 guidance. We've created a baseline for our state to say you can open for remote instruction, but you have to do that with significant safety protocols in place to make sure that we're protecting students and family. But school districts like Charlotte-Mecklenburg can decide to choose a full remote option, as many other school districts are choosing. Thanks.
Our next question is from Lynn Bonner at the News and Observer.
Very much for taking my question. This is Lynn Bonner from the News and Observer. Dr. Cohen, I've got a question for you kind of along those lines. We've got some of your data showing that cases among children are rising, and at the percentages, and that's now at 11% for children 17 and younger. Do you have any idea why this is?
Lynn, thanks for that question. So as we see virus spread across our communities, certainly we know that children can get COVID-19. We know it is less likely, and it does bear out in our numbers, children are less likely to get COVID-19, but they can get COVID-19. They are also less likely to get seriously ill, which is good, but they can get ill from COVID-19. They are also less likely, particularly for children under the age of 10, they are less likely to transmit the virus. And again, less likely doesn't mean never. So when we talk about some of these, what we are learning from the data is about risk and likelihood. And so what we know from the data is, again, kids get less COVID less often. They get less sick from COVID-19, and they, particularly children under the age of 10, seem to spread it less often to others. But again, that doesn't mean we're eliminating risk amongst children, and I think that is why when we put out our K-12 guidance for schools, you saw a sizable amount of safety protocols for folks to be able to come back in person, including face coverings, social distancing, screenings, hand washing, hygiene protocols. So we know that COVID-19 is there. We want folks to take the precautions that are needed to make sure that we can slow the spread of this virus. Thanks.
We have a follow-up from Lynn Bonner, News and Observer.
Thanks a lot. Given that these percentages are increasing over time, does this in any way change the recommendation on school reopening or the guidance on how to do so safely under Plan B?
Great. Thanks, Lynn. So where we are right now, I think our guidance is very strong. I've looked at a lot of guidance from around the country, different states, our own CDC guidance. I feel very comfortable about the safety protocols that are required from a Plan B perspective. Again, it's those tried and true activities requiring face coverings for all students and teachers and staff, limiting the number of folks who would be in a building to make sure you can maintain 6 feet of distance. So I think those are all the right safety protocols. I know that they are challenging as districts are working to make them a reality, and I know some need more time to make sure that they get those protocols in place, and so we support them either in moving forward with a Plan B with those safety protocols in place or choosing to be in a remote learning for all of their families. Thanks.
Our next question is from Jody McCreary with CBS 17.
Hey, thank you, Dr. Cohen. I have a two-part question. The first is that we noticed that some of the daily hospitalization totals are being updated a day or two later. For example, the number for yesterday was originally 1291. Today it was changed to 1272. So I'm wondering, what are some of the challenges you face in getting a full and accurate count of COVID patients in hospitals? And the second part of the question has to do with schools. If a person in a leadership position in a school tests positive, where do you draw the line between privacy and transparency when it comes to identifying that person?
Well, thanks for those questions. First, on hospital data, yes, hospitals are reporting to us daily. We do report the percentage who are reporting to us, and so we do have very good hospital reporting. I don't know that the change in data yesterday that may be that a hospital needed to change their data midstream for some reason. We can go back and check. But we are trying to collect that data and be transparent and make sure you can see that on our website. Our hospitalizations have slowly started to increase, and we continue to monitor that. But as we shared on Tuesday when I did a full update on our data, we do have hospital capacity. We've seen our utilization of ICU capacity stay stable, so feel good overall in terms of our hospital capacity and our ability to make sure that we're in close contact with them and know that we have that if there are going to be any changes in our cases. And as far as schools, schools is one place where they are required, if there is an outbreak, to report that to the local health department and then to the state. So that is something that we would record and then put that information on our website. You can already see that there are both childcare and school-related clusters of infection, so you can see that information there. As far as down to the individual level, obviously that is health information. There are many laws that protect personal health information, and so we are reporting at the school level in accordance with the law. Thanks.
Our next question is from Brian Anderson with the Associated Press.
Hi, Dr. Cohen. Brian Anderson here with the AP. Thank you so much for taking the time and the accessibility. I had two questions for you. First one, what is the plan to protect college students? NC State is less than 24 hours away from starting to have students come to campuses for moving into their residence halls. We are 11 days from NC State and UNC Chapel Hill reopening. We've tried reaching out to UNC system and haven't gotten any clarification on what you and your department are working on as far as any possible guidance statewide. So I just wanted to see, is that guidance forthcoming? What's come out of these ongoing conversations? And secondly, for K-12 schools, whose responsibility is it for getting cleaning supplies to teachers? We've heard one student yesterday at a roundtable, Denise Kent, who's a senior administrator at a local charter school, complained that there's not enough cleaning supplies like Lysol wipes, even though there's plenty of PPE, and that's preventing them from reopening 5 days a week. So I just wanted your thoughts on those two matters. Thank you.
Sure. Thanks, Brian. And first, as opposed to on higher education colleges and universities, we do have guidance. It is posted on our website. We'll make sure that you have it. So we have had a higher ed working group where we bring leaders from all over the state related to higher ed to work together on that guidance. You'll see our guidance nearly mirrors what the CDC guidance was for higher ed. We talk about some of the higher risk areas like dormitories and how universities can go about decreasing risk in those settings. I think you're going to see continued requirements around face covering similar to what we have around the state. So you can look on our website and we'd be happy to make sure to flag that for you specifically. I also know that UNC has done a very detailed operational plan that to make sure that that guidance turns into the operational reality. So I know a lot of hard work has been done on the university side, particularly on the UNC side, to make sure that campus reopening that is happening over the next number of weeks is done with safety protocols in place. I will say that we are going to have universities open with students coming to campus, some coming from out of state, and so that is definitely something we are keeping our eye on in terms of additional movement of people and of movement of virus, and so we will continue to follow that very closely. In terms of K-12 school supplies, as you mentioned, that face coverings has certainly been a priority for us. The governor had made sure that the state was going to purchase face coverings for every student and staff and teacher. Those have been shipped to schools. As far as other cleaning supplies, we've also arranged for every school district to have the ability to use some state facilitated contracting vehicles for them to order those supplies directly. So if there is a particular school district, we can follow up with the Department of Public Instruction in that district in particular and make sure they know about the ways in which they can order things. I'll remind you, I'll just say personally, getting some certain supplies has been limited. We know that supplies are limited across the country and across the world. The supply chains were tight on things like wipes, disinfectant wipes in particular. So we will work with folks to make sure they have as many of the things that are available so that they can continue to move forward if they want to for in-person instruction.
Our next question is from Jonah Kaplan with ABC 11.
Good afternoon, Dr. Cohen and Director Sprayberry. Dr. Cohen, I want to start with you, please. We had a chance to speak with Vice President Pence yesterday, who was actually very complimentary of the job that North Carolina is doing to be able to contain the virus and at least, not be in the predicament of the other states in the Sun Belt. I'm curious about what the conversation and dialogue you're having with the federal government right now. What are they saying to you from the White House guidance in terms of our phase 2? Are those adequate measures? Should we be easing restrictions? Should we be making stricter decisions? Also, what is the dialogue you're having with the Republican National Committee now that the President and Vice President are saying they are going to be here the week of August 24th? And Director Sprayberry, if I may, what is the level of urgency now when it comes to staffing for those potential, congregate living settings and those shelters? Do you have staff in case this turns into a pretty significant event next week? Or are you really worried that you're not going to be able to staff those places with folks who are not considered high risk? Thanks very much.
Well, Jonah, thanks for those questions. I'll start and then turn it over to the director. I'm pleased to hear that the Vice President has recognized the hard work that North Carolinians have done since the beginning of this pandemic. I think under Governor Cooper's leadership, we took early action to slow the spread of the virus and then also build up our response capabilities. And then as we eased restrictions, we did that slowly. And I think that has been really important in us keeping the virus level low. And when we saw that virus level start to increase, I think we've instituted a statewide mask requirement, and I think that has certainly also contributed to our success here. So I think all of those things are have helped us not be the the kind of fire that we're seeing in other states, particularly in the Southeast. I am concerned that there is a lot of viral spread around us, and so I think we're going to have to work even harder to make sure that we are doing all we can in North Carolina. And again, I think that national and federal leadership is so important, so that we do all have that the work together, whether it's face coverings, the social distancing, the slowing of easing of restrictions. I think those are all going to be positives. We continue to talk with our federal partners all of the time. I think that is improving in terms of they're giving us more and more guidance from the federal government. I think it aligns very much with what we are already doing in North Carolina in terms of making sure that we are keeping closed places that bring folks together and large groups together, the places like bars. They continue to reiterate that that is not something we should move forward with in terms of reopening. I think there's a lot of alignment there. As far as the RNC, again, we've heard some reports that things may be changing, but from the official reports on the ground, the RNC event continues to be, as far as we are aware, a one-day event in the Charlotte area on the Monday of the convention week, and that is what we are preparing for. So with that, I will turn it over to Director Sprayberry. Thank you.
Thank you, ma'am, and thank you for the question, Jonah. So as you realize, and as I discussed earlier, we do have some concerns about shelter staffing, but what we know is that the American Red Cross still does have staff to assist us. We know that the Department of Health and Human Services has a section called Human Services, and they have asked for volunteers, and they've got a couple of hundred volunteers to assist us with operating shelters. And we know that our local partners will stand up and help us operate shelters. And then finally, we've got several contracts that we just reviewed last month that can help us with shelter staffing as well. So I feel like right now we're pretty well positioned to operate shelters as they're called for. Thank you, sir.
We have a follow-up question from Jonah Kaplan.
Thanks very much again, Dr. Cohen. Next week is going to be a big week, not just because of the universities or schools. Again, we're getting a little closer, but also because the latest extension to phase 2 will expire by the end of the week. And I'm wondering if you can give any clarity about what you want to see before gyms can reopen. Thanks very much.
Sure. Thanks, Joda. So, you are right in that what we're going to see in the next number of weeks are a number of doors opening. And they're very important doors opening. And the governor's always said the priority of getting our kids back to school, particularly K-12 public schools back to school, is a priority. We know there are so many benefits to in-person learning. We have set a floor for the state in order to go back to in-person learning, to have all the safety protocols in place. We recognize that there are going to be a number of districts that are going to choose remote learning, but many are choosing to go back with in-person instruction. So those doors will be opening next week. The other doors that are opening, like as we've been talking about, are those university doors. Again, other important doors to learning for our state. And so that is a lot of movement and in terms of people and in terms potentially of virus. So I think we're going to want to watch our trends as always. We had been seeing about a 10, 12-day stabilization in our cases, but today we saw another high day of cases. So again, we're going to need to continue to watch this, and particularly as we see other things that are opening in the next number of days and weeks, we want to make sure that our trends continue to not just stabilize, but we need to go down. I do want to reiterate, we're still at a clip of a lot of new cases every day, which does stretch all of our response resources. So we do not want to stabilize at this high rate of new cases. We definitely want to see things decline. But like I said, we want to make forward progress here, and we know how to. We can make forward progress in terms of getting to a place where we open gyms and other kinds of activities, but we have to do the 3 W's. We know it works. Science tells us it. We see it in our own numbers. So what I would say to folks is make sure you're doing the 3 W's, the wearing of face coverings, waiting 6 feet apart, and washing your hands often. Thank you.
Our final question today is from Rose Hogan with North Carolina Health News.
Hi, Secretary. Thank you for taking my question. So we've been looking at prisons and the number of inmates in North Carolina prisons who've become sick. And what we can't find out is who's been hospitalized. Do you folks have any plans to release this information to the public? And do you even have access to this information? And, you know, how can members of the public see this?
Thanks for the question. I don't know the answer to that, so I will have to have our folks from the correctional side of things, unless Director Sprayberry, do you know the answer to that?
The question is how many?
How many have been hospitalized and are, do you know that answer?
There's 2 currently. So all of the offenders have been tested in all of the 55 correctional facilities at this time. Currently, we have 2 offenders hospitalized, and we ended up with a positivity rate of 2.5%.
Okay. Let me just see if Rose had a follow-up. Okay.
Yeah, this is a separate question. You know, we've been seeing. I know you've expressed concerns about folks from the Latino community who've been testing positive. There's increasing evidence that positivity is related to a lot of work in meatpacking plants, and yet the state's Occupational Safety and Health Office has been lax in issuing any violations or fines. You know, what kind of is your department trying to apply pressure to them? What kind of action are you taking to mitigate the risk in these facilities?
Well, thanks for that, Rose. Yes, you are right. We are concerned about viral spread in the Latinx community. They're not only folks who work in meatpacking, but they work in our agricultural sector, in manufacturing, in construction. Excuse me, all industries that we know are essential. But we also know where that is social distancing is challenging. From our end, in terms of what we have been doing, as you know, we have a lot of guidance and not just recommendations, but requirements around how folks should implement some infection control measures. We don't just require face coverings, we require medical grade masks for those who work particularly in their meatpacking plants, because we know that those are highest risk because folks are close together, it's cold, they have to shout because it's loud. So again, the most high risk that we have. So we are doing all that we can to make sure that we work closely with these organizations. If they have any outbreak or concern, we've always been available to go on site, give guidance on infection control protocols, and that's what we continue to do and exercise our influence from the side of education and training. Okay, I think that was the last for today. Thank you again. Today, again, was a focus on mental health. Remember to understand the scoop on mental health. Make sure that you are taking care of yourself and your family, and that you are following the 3 Ws. Stay well. Thank you.